If you ever find yourself in an uncomfortable situation with someone who is supposed to be a professional but is acting anything but, what do? While the Utah Division of Professional Licensing has a reporting system, they're taking it a step further in an effort to tackle the rise of sexual misconduct complaints. Jana Johansson, Assistant Director for the Division of Professional Licensing, DOPL for short, says they've seen an increase over the past couple of years in sexual misconduct complaints. And there isn't one case in particular that led them to create a task force to put more eyes on the issue.
We've just noticed an increase in cases across the professions. So we're looking at specifically nursing, chiropractic, massage, mental health, medical, just any of those kind of touching, more involved professions.
One of the most notable instances of sexual misconduct as of late is that of former OBGYN David Broadbent, who faced numerous felony charges accusing him of sexually abusing patients. More than 450 women filed civil lawsuits against him. And earlier this year, the agency announced new ways it would crack down on sexual misbehavior in massage parlors. When sexual misconduct cases are reported to DOPL, the case is given an initial review and then given a priority ranking, and then it goes straight to investigators. They usually try to wrap the case in no more than 30 days, but Johansson says there are ways to improve upon what they're already doing.
We are hoping that we can get an outside look at our policies and processes to see if there's any holes. You know, when you're working on inside of something, you don't see all of the holes that there might be. And so we're hoping some outside eyes can help us see those kind of gaps in our process.
The goals of the task force include developing a unified interagency protocol that standardizes the process for sharing and cross-referencing reports among state agencies, creating a survivor resource map, a digital resource to help survivors navigate available criminal, civil, and administrative options, implementation of public awareness initiatives like mandatory training for licensed professionals and state agencies, and compiling a list of recommended statutory changes.
So it's really important to know what your provider, whether it's mental health or doctors or nurses, chiropractors, you need to know what they're able to do, what their scope of practice allows them to do. And by looking at kind of the DOPL website, looking through the laws and rules, or even just calling in and speaking with someone that works with that profession, we can help you understand what their scope of work is.
If you need to file any complaint with DOPL, including sexual misconduct complaints, you can find them under the same place on DOPL's website. Any resources and tools that develop from this task force will be shared on the division's resource page for consumers. Licensed professionals will be emailed about any changes that directly impact them. Robin Oginye, Fox 13 News, Utah.